The other day you said something about they did a study on babies that were born, and during the birth process, like 80% of them?
Yeah, birth traumas are very common. Okay, first off, the way we give birth right now, okay, is
Laying flat down on your back.
laying on the back in the recumbent position. That process was started by Henry VIII.
Okay,
Okay, who had no concern about the health and well-being of the mother or the child.
right,
Okay, he just wanted quick identification so he could decide what he was going to do.
yeah,
Okay, but you know, giving birth laying on your back is very traumatic, not only on mother but also on baby. A whole lot more force, a whole lot more pushing has to be done in order to get that baby out of the birth canal. Those things are slippery and slimy for a reason. Okay,
Yeah.
if we were in a stand-up or a squatted position, okay, gravity would help those babies come out without so much force.
And most women in other countries use a birthing stool of some kind
Use
where
a birthing stool,
they're sitting.
or they're sitting or squatting.
Yeah.
Absolutely. So birth traumas. Okay, you mentioned the European study. It was done by a researcher by the name of Gutman and his associate Fryman.
Okay.
And basically they evaluated 2,000 infants between the ages of 0 and 5 days old, newborns to 5-day-old. And what they found is that 80% of those children were already showing signs of autonomic nervous system imbalance. Okay. Now the autonomic nervous system is our sympathetic and our parasympathetic nerves. Okay. Sympathetic nerves speed things up as a general rule. Fight, flight, get us out of the way of the falling
Right.
right. Heart beats faster, lungs increase, blood flow to our muscles increase. Okay. Sympathetic nerves also tend to shut down the digestive tract. Okay, you don't care about digesting your White Castle, okay, when you're getting out of the way of the falling rock.
Right.
Okay, the parasympathetics have basically the opposite effect. They increase blood flow to the digestive tract, and they diminish blood flow to the heart and to the lungs and slow down their activities. Okay, well, what Gutman was able to demonstrate is that 80% of the infants between the ages of 0 and 5-day-old were already showing signs of an imbalance in those two systems. It would manifest itself in the forms of poor feeding patterns, ear infections, colic, general failure of the thrives, okay, temperature regulation problems, okay, all those sorts of manifestations. Found that the majority of those autonomic nervous system imbalances was a result of a distortion at the base of the skull in the atlas vertebra, the top vertebra right underneath the neck.
So during birth, they're
During the birthing process, and I've seen dozens of training films on
delivering babies.
delivering babies.
Yeah.
And in normal text, okay, on a training film, they showed one doctor taking a baby's head and rotating it nearly 180 degrees, okay, as he tried to help that baby go through restitutions on the way out of the canal. What happens during the birthing process is the head and the body have to go through a series of corkscrew procedures, okay, in order to turn around and come down and out.
Right.
Okay, and unfortunately, our OB doctors tend to get a little bit anxious, okay, wanting to speed the process up.
It's money.
It's money.
Yeah.
Okay.
I can do 5 instead of 3 in a day.
Exactly. And so once that baby's head's out, okay, they don't want to wait for restitution. So what they tend to do is they tend to rotate that head real far to one side, okay, so that they can pop out the upper shoulder. Okay, and then they'll rotate the head real far the other way and pull up so they can pop out the bottom shoulder, and then the baby will come on out. Now, the baby has the ability to do that on its own if we just kind of back off and let it.
Right.
Okay, but no, we want to get it out as rapidly as we can. Okay, so they're taking this young infant spine, okay, that has no experience in weight bearing whatsoever except for a little bit of in uterine, but it's floating in water there.
Sure.
Okay, and so you've got these young immature joints, okay, with this oversized head sitting on top of these undersized vertebra, okay, and you're taking it through extensive range of motion, okay, and it's getting stuck there. Okay, and so they pull it out, and you know, this vertebra is twisted off to one side or the other, and it starts interfering not only with the nerve roots right there, but also interfering with the brainstem itself. Okay, a lot of sudden infant death syndrome, crib death, okay, is linked to upper cervical spine trauma. Okay, another major factor involved with that, and we'll talk about it in another lecture, is the vaccination issues which are associated with sudden infant death syndrome. But physically, the trauma of birth is very difficult on the baby. Okay, that's when it gets its first. If it's sitting in the uterus properly, okay, then it's getting its first trauma at the birth process.
Okay.
Now, just for the record, if the mother spine is distorted, particularly the pelvis and the sacrum, if it's distorted during her pregnancy, that causes a torsioning and a distortion to take place in the uterus. okay, and we end up with what's called in uterine constraint, okay,
Mhm.
where the baby is unable to turn around and move in an appropriate manner inside the uterus, okay. And by the 7th month, the baby is supposed to be in a vertex position, head down.
Right.
Okay. If it cannot flip over because the uterus is torted, okay, well then it ends up crammed into the uterus with its head being pushed down if it's in a true breech position.
Sure.
Okay. So we end up with babies with no necks virtually, okay,
Right.
because everything's compressed down. If it's in a transverse line, okay, either a brow or facial presentation where it's laying crosswise in the uterus, well then we end up with a baby with an extensive hyperextension injury, okay, and that can cause problems. As a matter of fact, we know that cellular growth is 7 times greater in the in uterine fetus
Mhm.
as opposed to the infant, okay,
After it's born.
after it's born.
Right.
Okay, so if you've got cellular activity taking place 7 times the normal rate of an infant, and it spends 3 months with its head compressed down
Yeah.
like that, it's going to cause some morphogenic changes,
Sure.
okay, in the developing process of that spine. So that's why it's important for women during pregnancy to get their body properly taken care of.
Okay, so let me start to try to summarize here, and we'll take a little break.
Right.
If the woman during pregnancy takes care of her health
Mhm.
nutritionally and
Nutritionally and physically.
physically, keeping it aligned,
Yes, sir.
keeping the muscles toned,
Right.
and the baby is born properly without the twisting or the jerking or all those kind of things,
Right.
which a lot of that happens in hospitals,
Oh, yeah. A high percentage of them get dropped.
and dropped, yeah. Okay. Then the chances of the baby's health being good are much better.
Much better.
And in the Bible, they talk about wrapping people in swaddling clothes. My understanding is that the custom of the Middle East folks was to take the baby, pull it out straight,
Mhm.
and wrap it up. Hold it straight.
Yeah. Yeah. You know,
That's what swaddling means.
that's what swaddling means. You know, the baby has just spent, you know, if everything's gone well, 9 months, okay, in the fetal position.
Right, right.
Okay, and you know, when you're coming out of the womb, you know, and you're exposed to gravitational forces and things along those lines, okay, if you don't properly handle that baby, okay, and that's why C-sections are so horrible, okay, because when they're doing C-sections, okay, I mean they're grabbing the first part they can get a hold of
Pull the baby out.
and pulling the baby out, okay, and so I mean you're just dealing with, you know, early childhood distortions, okay. If you stretch that baby out, not too extensively, but if you
Right.
stretch that baby out and wrap it up and give it some time to maintain that new proper position, okay, you're going to stop a whole lot of childhood development problems,
Right.
okay, that are continuing to occur because of the distortion. Volkmann-Wolff law, laws in physical medicine, says that tissues grow according to the stress that's placed upon it.
Well, a bodybuilder that builds his muscles also builds bigger bones.
It also builds bigger bones.
Slower, but
Slower. But if you have a shift in weight bearing, if you are carrying more weight on one side of your body compared to the other side of the body because of a distortion or a trauma or something along those lines, well then those bones will actually begin to model themselves and you'll end up with wedged vertebra or vertebra that are thinner on one side compared to
Right.
the other side. Okay?
and then it can become real permanent.
And then it becomes a permanent process.
Oh,
Okay.
great. Let's take a break and we'll come back and talk about vaccinations, how they tie in.
Okay?
Thank you.
The top 4 leading causes of death in the